where parents cannot parent. Children are prohibited from living in childhood innocence, and history repeats itself generation after generation by holding each suffering soul hostage. This is a world where emotional and physical abuse, adultery, birth defects, developmental delays in children, homelessness, hepatitis, AIDS, financial loss, fear, and desperation are a part of daily life. Individuals fail as students, employees, friends, and family members, where the scrutiny of trust no longer exists. The majority of inmates in jails and prisons are incarcerated for crimes related to addiction. Every person, family, and community affected by addiction is living their own personal war. We truly are living with an epidemic. Any other disease resulting in such devastation would become a matter of national attention. There would be a declaration of emergency. Money and manpower would be dispersed immediately to address the urgency of the situation. In recent years, Open Doors client admissions has more than tripled. We are short-staffed, operating out of inadequate space, and are underfunded. We have individuals walking in daily, literally daily, that are in need of help. Waiting lists for residential treatment are most often 3 to 4 months long. As an intensive outpatient treatment center, we are often treating individuals who truly need inpatient care. It would be unacceptable for the treatment of any other disease of this magnitude to go untreated or postponed due to unavailable services. It is disturbing to look into the eyes of a fellow human being who is suffering and desperate. It is more disturbing to be in a position where you aren't able to meet the immediate need of these individuals. I have more in here I'm going to skip over for the sake of your time and mine, but I will be sharing the rest of this with you in writing. I will make sure that you get this. The only thing I wanted to share, and I realize I'm out of time, is a little more about the Hills House piece. Victims of the disease of addiction are often the unborn fetus, newborns, and children. This disease often has a generational component, which can lead to dysfunctional and destructive cycles of behavior from one generation to the next. Whether it is a pregnancy, newborn, or child, these young, vulnerable little ones become victims of the disease along with the parents. There are many complications that arise when a baby is separated from its birth mother, such as attachment disorder and separation anxiety. At Open Door and Hills House, one of our main goals is to treat the disease in the parent while keeping them unified with their babies. With a grant received over a year ago, Hills House was doubled in size and so on. We are now able to treat 8 women at the same time with their infants or during their pregnancy or both. Moms and their little ones live at Hills House up to 6 months while attending IOP at Open Door, which is on the same property. When appropriate, we work to include the baby's father into the process with the condition that he is willing to receive treatment and drug screen and comply with the requirements of the program. We provide, and again, I'm going to shorten this, you will get it, but we provide multiple services to these young women and to the babies and to the families, and do have 24-hour coverage, supervision, and treatment. I want to skip down to, at this point, we have a shortfall for opening of around $150,000. Been able to raise enough to open the facility and to sustain for a year while we get our billing cycle going for insurances and private pay and main care. But in the meantime, we do have that $150,000 shortfall, which I'm still working very hard to obtain. So, obviously with what Open Door does, we work closely with law enforcement, we work closely with jail staff, sheriff's department, state police. So I support 100% whatever can be done to support them, as they are also supporting us 100% to do what we do on the treatment side. We're very, very blessed also to have the collaborative effort that we have between all of the hospital, law enforcement, school systems. We have a wonderful community that circles together. So I thank you for your time, and I wish you well as you're looking at all of this, making decisions you need to make.
Thank you. Have a question from Representative Thorne.
Actually, just briefly, I had a chance to work with Ms. Royal to the Hancock County Drug Court on a case, and I just wanted to commend her for the work that she's doing, that Open Door does, and wish you the best as you continue to help some folks transition to recovery.
Thank you very, very much.
Thank you again. Bob Fowler?
Good evening. I'm Bob Fowler. I'm the Executive Director of the Milestone Foundation. I know Milestone has been mentioned a number of times throughout the day. Just briefly, Milestone is located both in Portland and Old Orchard Beach. In Old Orchard Beach, we have a residential treatment center for 16 men. In Portland, we have a homeless outreach program, a 41-bed substance emergency shelter, and the state's only non-hospital based detox program. So that detox program is 16 beds for men and women, and we work with people regardless of their ability to pay for the service. I'm here in support of this bill and all aspects of the bill, the law enforcement piece, and then certainly the pieces around recovery centers, outpatient treatment, and the proposed detox program in the Bangor area. I'll mention that I think probably just two things. With regard to our detox program, when I look at the statistics of the use of that detox program over the last number of years, it used to be just a few years ago that 100% of those detoxes were for alcohol detox. And the numbers, the lines crossed pretty dramatically in the last couple of years where it's 50-50 now between alcohol and heroin, opiate detox. So I don't think that really comes as a particular surprise when we know that we're in the midst of this epidemic. I will say that we receive anywhere between 10, 20, sometimes 30 calls a day for that detox and are unable to accommodate the majority of those calls because the program is full. So I think there's no question that there's a tremendous demand that our current system's unable to accommodate. In our residential treatment program, of this 16-bed program for men, 15 of those beds are reserved for Maine care individuals. One is a state-funded grant bed. We typically have a very long wait for that one grant bed, and we often have Maine care beds that are unfilled because we don't have enough Maine care eligible individuals to fill them. So at a time that we really kind of have this mismatch between this tremendous demand in the state for residential treatment, and we have unfilled bed because of the not having enough Maine care eligible individuals. So trying to do some work with the department to see if we can increase the availability of some of the state-funded grant beds to have an immediate opportunity to increase that resource to people dealing with this addiction in the state. So I'm here just in support of the bill, and I'd be happy to answer any questions or provide any information. I know the hour is late.
Questions? Representative Martin?
Thank you very much. I'm curious in terms of, has the department refused to allow transfers for 30 days or so at a time for a bed?
I don't understand the 30 days at a time.
Well, or 60 or whatever it may be, to go from, if you can't fill it with Maine care, that you can transfer that bed off the Maine care system until that person is treated and then go back to having a facility?
Well, we've just put the request to the department just a couple of weeks ago, so we're waiting to hear back.
Because they do allow, for example, nursing homes and boarding home changes flipping back and forth. So I'd see no reason why they would not allow that.
Okay,
And so if you have a problem with that, let me know.
excellent, thank you.
Representative Grant?
Thank you, Mr. Chair. So in your case, when you say that you have Medicare beds left unfilled, Medicare, well, this is
Maine care beds, right?
Yeah, Maine care, sorry,
Yes.
Maine care beds. when you leave money on the table, it's because you have people in need who can't get into your program, but you still have money left on the table because the people who need the program don't qualify for the money.
Yeah, I don't know that we have had money left on the table in our case. I think generally, when we put our budget together, we put together the budget, and I think for the last couple of years, because we serve such a large proportion of folks who don't have any kind of a pay source, we don't end up having that problem, that issue.
And then my other question is, the young lady that just told her story a little while ago mentioned that there were only 6 beds for adolescent girls in the state of Maine for treatment. Do you know how many beds are available in the state of Maine for adolescents?
Milestone doesn't work with adolescents, so I don't know. I know for adult women, really for everybody, there are not enough residential treatment beds, and for adult women, there's a significant absence of beds. On the adolescent side, I'm certain there are not enough resources, but I can't really speak to that.
Senator Cates.
Thank you, Mr. Chairman. Just a quick question. You call the Maine Care daily rate that you receive?
For the detox?
Yeah.
I'd have to find out. I know our cost is $270 a day. I'd have to see what our rate is.
You could put us on the
Sure.
Thank you.
Any further questions? Seeing none? Thank you.
Thank you.
Melissa?
Hi, everybody. My name is Melissa Skane. I'm Vice President of Mission at Mercy Hospital. And I'm here today representing both Mercy Hospital and our partner organizations in Greater Portland. As you know, treatment options have become extremely limited for uninsured residents due to declining reimbursement by commercial payers and high rates of uninsured persons seeking treatment. Since 2008, Mercy Hospital has seen a 75% reduction in reimbursement from commercial payers and a 56% increased rate of uninsured residents seeking treatment for substance use disorder. These uninsured patients are the non-categoricals who would have previously been covered by Maine Care. The recovery center was not sustainable financially and was frankly not designed to address the heroin epidemic. Over time, the recovery center had become the state referral center for addiction services, and the population seeking treatment changed from alcohol to benzodiazepines to opiates. Our model had to follow suit. Opiate withdrawal does not require inpatient admission, and what we would often see is patients from northern or western Maine would have no ability to enter our partial hospitalization or intensive outpatient programs due to lack of housing or concrete supports in place. Without local treatment options, patients would return often to Mercy for a 24 to 48-hour detoxification, only to re-enter their communities without local services, and they'd re-engage in a cycle of addiction. In June 2015, we closed the recovery center in Westbrook. We relocated our partial hospitalization program and our intensive outpatient program to the State Street facility. We also added addictionologist coverage to our primary care centers. This model is recommended as best practice by the American Hospital Association, the American Academy of Family Practice, and the American College of Surgeons. And it's well received by patients. Substance use disorder is a chronic disease, and the ability to receive comprehensive care in the primary care office lessens stigma and improves both engagement and outcomes. The desire to build capacity using proven models is widely held in Greater Portland, today by civic leaders, law enforcement, criminal justice, community organizations, and healthcare providers. Mercy Hospital has convened the Greater Portland Addiction Collaborative. We hired a strategic planner to move conversation to action. The group includes leadership from Mercy, Maine Medical Center, Portland Community Health, City of Portland, Milestone Foundation, Amistad, Community Housing of Maine, Preble Street, Portland Police Department, Opportunity Alliance, Catholic Charities, and Portland Recovery Center. The intent is to meet just 3 times to develop a low-cost, comprehensive, and payer-agnostic system model for eviction services and determine cost and funding. We held our first meeting in December and reviewed utilization across the continuum. We recognize that the Milestone Foundation, as Bob Fowler just alluded to, turns away roughly 100 individuals each month. And the group is committed to develop a collaborative, effective, comprehensive approach to address this unmet need. Comprehensive services include access to substance abuse treatment, safe, sober housing, access to primary care, mental health services, education, employment, peer support services, and recovery-oriented skill-building groups. Through the creation of this formal collaborative in Greater Portland, we'll draw upon the existing strengths of our partner organizations and eliminate waste or duplicative efforts. We'll enliven community assets, especially from the recovery community, many of whom you've heard from today. We will reconvene in January and are looking to expand detoxification services in community. We are combining outpatient services to reduce cost and developing structured sober living environments with a high level of accountability, working closely with law enforcement and peer support workers. This effort will require funding. The vast majority of the population, as you've heard today, is uninsured and extremely vulnerable. We strongly support the additional funding identified in this bill around peer support services, residential treatment for uninsured, and substance abuse outpatient services for uninsured. We urge both committees to target the funding for communities in need and that have collaborative partnership to representing a comprehensive and integrated approach to address Maine's substance abuse crisis. We're committed to continuous evaluation. It's very much a part of this work, and expect to be held accountable for the efficacy of the services we deliver. Maine needs a new and comprehensive approach to impact this heroin epidemic that is local and evidence-based as we steward our limited resources. Thank you for the opportunity. You're welcome.
Thank
Questions?
you, Melissa. Representative Martin?
Thank you very much, and thank you for your presentation. I'm going to somewhat put you on a, not right now, but excuse me. You talked about developing a new approach. I wonder when you drive home tonight and tomorrow, when you go back to work, if you could put the name of 10 people together on a list that you think could get together to put together a plan that we could use. Because obviously, I think we have a dilemma in terms of people working together, wanting to work together, wanting to produce something. But if you could put together 10, 12 of the best people that you know of that could develop a plan, maybe we might be able to get somewhere with it.
I tell you, the group that we have convened in Portland are the leaders of every organization that touches the population. And
But
we're
that's
very-
Portland, I want the whole state.
The whole state. Okay.
Thank you.
Representative Graham?
No big task.
Thank you, Mr. Chair. After listening all day, and then there's a sentence in your testimony that really jumps about the recovery center at Mercy was not sustainable financially and not designed to address the heroin epidemic. And I think we could safely say that all of our systems across the state were not set up for the heroin epidemic and have not, we've had pockets of success in places. We
Yeah.
have opportunities of hope in places,
Right.
but to pull together something comprehensive and really workable is going to take, this is a good first step, but it's going to take a lot more. And it struck me listening to you that we have a lot of things to build on, right? A lot of resources, a lot of assets, as we used to talk about in asset and risk conversations. But I'm really hoping that this is the beginning of that conversation and not, okay, we've done this bill and now everything is great. Do you think that the time is right, if this bill passes, that we will see a coalescing of other leaders across the state to do this work and ramp up for what we were not prepared for?
Yeah, I would absolutely hope so. I mean, I think what we see in the greater Portland market is we cannot compete head-to-head offering the same services. We have got to come together and eliminate waste and duplicative efforts. You know, intensive outpatient care, it doesn't necessarily need to happen in the acute setting. It can happen in community. What are the other assets that we can enliven that will reduce cost and be effective? There's great models across the country. We need to draw upon them and then implement them. This group is very focused on implementation, really moving from conversation to action.
In some of my work over the years, it's very clear to me that if you took what you're talking about, these are the kinds of things that the federal government would fund. Back in the day when we talked about evidence-based programs, accountability, evaluation, and a comprehensive community approach. And we have that in place. This is not all new. So it's really important, I think, for all of us to keep in mind that this work is being done, has been done, and that we can take it to the next level. So I really appreciate the way you summed it up here. Thank you.
Absolutely. It's really the coordination and the collaboration that needs to occur.
Thank you. I must say that over the years, many of the constituents in my area have used and had used Mercy in Westbrook. And having seen that close was really harmful to at least those of us in Aroostook County that use it as a resource for both drugs and alcohol. And so now it's very difficult for someone from Aroostook to find a place to go.
Well, I do hope that we create a model that can be easily replicated. You know, I think as difficult as it was to close that center, it truly was not a good use of resources, and it was not addressing today's need. Really, we were not having the result, the outcomes that we can.
Thank you. Lisa, you know you're on.
I am. Good evening, everyone. Lisa Hartley, McPherson, East Maine Healthcare Systems. And I'm here today on behalf of our comprehensive health system serving the state of Maine. For purposes of this bill, I want to thank Melissa for her testimony on behalf of Mercy, and also note that Acadia Hospital serves as an addiction center of excellence serving northern Maine. You heard a lot about the Bangor Leadership Collaborative and the proposal for social detox in Bangor. I'm not going to repeat that. Support that. Acadia Hospital and each of the medical centers leaders were founding members of the Leadership Collaborative, and we strongly support the work of that group. As I travel around EMHS, and this is a significant issue across our health system, I am struck by two things. The discussion in a rural community like Pittsfield, Greenville, Piscataquis County is very different than the discussion I have in Bangor and Portland. The needs are different. I mean, the fundamental issue of addiction is a problem. The heroin issue is a crisis. But there are resource intensity challenges that are different in urban and rural communities. I'm also struck by the strength of a collaborative that is comprehensive, integrated from law enforcement, education, prevention, treatment, recovery, peer supports, housing, employment. When you have all organizations touching the lives of these individuals in recovery, you have an opportunity, as Melissa talked about, to be really effective at the community level. Your challenge is there are resources that are needed in communities, and how can we hold communities accountable to really effectively deploying these resources for strategic interventions that help solve this crisis. I encourage you to have some language that requires communities to have a truly integrated approach with accountability loops back to you or the department on the work that they're doing and the comprehensive nature of those communities coming together to do asset mapping, gap analysis, and bringing resources to the community. I also have to identify a weakness in the bill, and you've heard about medication-assisted therapy. It is the evidence-based treatment that has research behind its efficacy. It's not in the bill, and I understand the delicate nature of how the bill was crafted, and I look forward to many opportunities in the Health and Human Services Committee to talk about the need to adequately fund and expand medication-assisted treatment, as well as supporting access to resources for the uninsured to receive coverage for their care. And with that, I welcome any questions that you have with 10 seconds to spare.
Are there questions?
Yes.
Okay, please, Representative Grant.
Maybe somebody can answer, whoever is out there can answer for me what the number of adolescent beds are in the state. Maybe somebody who's coming up to follow me, or maybe somebody from the department.
Okay, I can clarify, I don't have that answer.
Thanks.
Any other questions?
Thank you very much.
Thank you.
Leonard Smith? Oh, you are, great. Welcome.
Thank you. Hi there, thanks very much for having me. My name is Leonard Smith, I'm from Portland, and I'm here today as a private citizen to express my support for R2599. And as I say, I'm here in my capacity as a private citizen, but I am a person in long-term recovery, and I've worked in the field of substance abuse treatment for 11 years now. I work for a company called Omnibus. It's a 12-step based rehab in New Hampshire, and I work for them now full-time in an aftercare facility in Portland. So I'm intimately and daily immersed in the struggles of people trying to find the resources to get well. And I guess one of the things I'd like to remind you is that this disease doesn't discriminate. We don't need 6 degrees of separation for, I think, anyone in this room to think of family members, neighbors, loved ones, be it parents, siblings, children. Statistically, I just Googled on my phone just so I had some statistics, but the National Council on Alcoholism and Drug Dependence says 1 in 12 Americans are alcohol dependent. And the Substance Abuse and Mental Health Services Administration said in 2013 that 24.6 million Americans over the age of 12, which they say is 9.4% of the population, as a drug problem with one drug or another. So that's, a tenth of the population. Statistically, some of your peers probably struggle with alcoholism or drug abuse, whether it's common knowledge or not. The consequences of some of the cutbacks that we've seen, and the decision not to expand Medicaid and not to receive the federal funds that would have come with that, have been a tightening of resources in general, just kind of the shredding of the safety net. And whether that was a good decision or a bad decision is not mine to say, but it's a decision that's had consequences. We've seen, you heard the one woman speak who went through Crossroads. Crossroads operated another house in Portland, the Back Cove House, which closed its doors shortly after the funding cuts and became a self-pay $15,000 a month facility, which no one without insurance can touch that. I know a number of women whose lives have been saved had been saved by the house in Back Cove. The concerns about the efficacy of treatment and, you know, whether you're throwing money down a, you know, a vast and fruitless hole. I know, you know, basically through my 11 years of experience working in the field, I literally know hundreds of people who were considered lost causes, who have established long-term recovery, are gainfully employed, paying taxes. Some of them are entrepreneurs, some of them have gone back to school, done degrees, some of them work in the field of substance abuse like I do. I'm a property owner, I pay taxes. The dollars that you're trying to decide whether or not to spend or how to spend, they're your tax dollars, they're my tax dollars, they're the dollars of the people of Maine, and we really should spend them on the people of Maine to save lives. The outcome of any given trip to as you mentioned, this is a chronic condition, and not every trip to detox, not every attempt at rehab is successful. It took me many tries. I was 44 years old before I got well, and a veteran of, I've been to Mercy, I've been to Milestone, I've been to expensive places, I've been to free places, I've been to some bad places. But, and the thing is that insurance-driven medicine, insurers will tell you, they want to pay for less and less. They're in the business of making this as few expenditures as they can. So they say that heroin, that opiate withdrawal, is a non-life-threatening situation, and therefore they won't pay for it. However, not going to detox if you're shooting heroin is a life-threatening situation. It's absurd. It is absurd. There are just not enough resources. There are not enough beds. Any trip to detox or to rehab, whether it's successful or not, is a point in time where the person in question, A, is not likely to die by misadventure, and B, could potentially become interested in and engaged in long-term recovery. And it's a huge mistake for us it would be a huge mistake for us not to support this. You've heard it from law enforcement too, which I think that was, I'm not against funding the law enforcement end of this, don't want to declare open season on the citizens of the state of Maine, but I think it was really terrific and moving to hear the awareness of the law enforcement agents that spoke to you today that, in fact, I was struck, the article in the Press Herald, and I'll close with this, the article in the Press Herald said that one of the concerns is spending money on things that won't work. And yet we don't question throwing money at the war on drugs, which has basically not worked. At least not by itself. Not by itself. Unless we do something on the treatment end of things. You can lock people up, but all you're doing is warehousing them without actual treatment to change their values, the way they think, the way they live their lives, and the choices that they make. They'll be back again and again. Thank you very much for your time.
Thank you very much, Mr. Smith. Thank you.
And questions if there are any.
We appreciate your being here. Thank you.
Robert Ashford? Going once, going twice. And Jeff Austin?
Senator Hamper, Representative Rotundo, Representative Team, members of the committees. My name is Jeff Austin. I'm here on behalf of the Maine Hospital Association. I will be brief. I don't have much to add. I'd just like to touch on 3 points. One, the issue of substance abuse, along with the issue of mental health, is the combined number one issue that we hear about. They manifest themselves often in the same ways: calls to the police, trips to the emergency department, and ultimately failure to address the issue. All too often this is what happens. It's a concern in the emergency department. It's a tragedy in the maternity ward. And what we are hearing about is a huge amount of worry about what happens when these drug-addicted babies grow up. And there's going to be a wave, because we are on a wave of heroin addiction. There is going to be a The second thing I'd like to say is that we heard the department's testimony and the number of topics that they touched on, and while I can't say without seeing more language that will support what they articulated, there's nothing in what they said that appeared to us to be mutually exclusive to the goals of this bill. There are ideas, there are things to talk about, there are ways to improve systems that are out there that they mentioned that aren't in this bill, but I don't see those as reasons not to pursue the goals of the bill that's before you. Third, and it's been mentioned before by others, and I would feel very remiss if we did not bring up the Medicaid expansion issue as well. You've asked about comprehensive strategies from the treatment side. You have heard from clinicians and people in recovery, people who run services, and I'm sure you'll hear from them as you try to decide what are the best combinations of services to provide. But at some point, you're also going to have to confront the financing policy and how do you finance this combination of services. I'm not an expert in it, but there is an opportunity out there with a comprehensive financing scheme available with Medicaid expansion. Is it the magic wand? If you expand, does every addict get treated and recovered? No. But it does jump out to us as it has to others as a real good solution on the financing side, just as you need a real good solution on the clinical and treatment side. So with that, I'll wrap up. Happy New Year to you all. I'll see you at Young Shore, and I'd be happy to take any questions.
Questions, anyone? Okay. Be seeing you in the hallways, for sure. Dawson Julia. For a second go-round.
Hello, thank you for hearing me today. I appreciate everybody staying. I am on the last on the list. My name is Dawson Julia. I live in China, Maine. I'm also a medical marijuana caregiver, and I'd like to talk about how we're treating this currently. It's kind of like how we're using smartphones today, but 20 years ago we had no cell phones, let's say. And